This is Cervical Screening Awareness Week. Go and get yourself tested. A few days ago, a man tweeted his experience of giving a girl a head, otherwise called cunnilingus, and came down with blisters around his mouth. And judging from the characteristics, it could be differentially diagnosed as oral herpes, caused by the herpes simplex virus. For more information about STDs and oral sex, I talked about it on a full episode, the correlationship between blowjobs and STDs. So please click on the link above or in the description box below to watch the full episode and know how to protect yourself. Hi and welcome to Funky Female Friday, otherwise called Triple F, where we talk about women's physical, sexual, and mental health. Please remember to hit the subscribe button and turn on your notification to stay updated on my weekly post every Friday at 8 p.m. 5 months ago, I talked about sex and cancers, and one of the cancers that was highlighted was cervical cancer caused by the Human Papilloma Virus, or HPV, known to be sexually transmitted. The cervix is the neck of the womb, and anything that goes into the womb from the vagina must first pass through the cervix. It is important to note that the HPV can be gotten from oral, vaginal, or anal sex, and this can be avoided by vaccination or using a condom and dental dam during sexual activities. The virus is so versatile because not only does it cause cervical cancer, it also causes cancer in your vagina, throat, vulva, and anus, as was discussed in my previous episode, anal sex, healthy or unhealthy. The men are not left out, as it can also cause penile cancer. It is a very common virus that is transmitted from one person to another without a carrier being symptomatic. If you are over 21 and you are sexually active, then it is advisable that you go and do the Papanicoloau Smear, otherwise called PAP Smear test. This test is done to screen for abnormal changes in your cervix that could be indicative of cervical cancer. Cervical cancer is not a death sentence, and it is treatable with a 92% 5-year survival rate as long as it is caught early. This test is recommended to be done every 3 years. Do not carry out this test if you are menstruating, and ensure to avoid sexual intercourse, douching, using any spermicidal agent or vaginal products for at least 48 hours before the test. Whether or not you have done the PAP smear, ensure to see your doctor if you notice any of the following: abnormal vaginal bleeding, persistent pain during sexual intercourse, development of warts around your genital region or any other part of your body as previously discussed. It usually presents as a bump with a cauliflower appearance. The HPV vaccine is available in the forms of Gardasil and Cervix. It is taken in 3 doses on 3 different intervals and has been shown to protect you from the deadly forms of the HPV. It works best if they are completed before your first sexual intercourse, and so in some developed countries, it is given routinely to boys and girls aged 11 to 26 years. Take charge of your health today, and remember to subscribe to my channel, and I will see you same time next week Friday.